My name is Emily Ferguson, and I did my disease project on tuberculosis. I will show you a little bit of the screen first, and you'll see that is what I did. Okay. Get this set back up. Okay, so tuberculosis is caused by a bacterium called Mycobacterium tuberculosis. The way that it can be cultured or isolated, tuberculosis is a slow-growing bacterium that is a etiological agent of tuberculosis. Agar-based and egg-based media incorporating green malachite and Middlebrook broth or solid media are recommended as the gold standard for isolation, culture, and definite diagnosis for tuberculosis. Where is tuberculosis found? Most of the people who fall ill with tuberculosis live in low and middle income countries, but tuberculosis is spread all over the world. About half of all the people with TB can be found in 8 countries. That includes Bangladesh, China, India, Indonesia, Nigeria, Pakistan, Philippines, and South Africa. How is tuberculosis spread or transmitted? Tuberculosis is a bacteria spread through the air from one person to another. The bacteria is put into the air when a person with TB of the lungs or throat coughs, speaks, sings. People nearby may breathe in the bacteria and become infected. When a person breathes in the disease, the bacteria can settle in the lungs and begin to grow. From there, they can move through the blood to other parts of the body, such as the kidney, spine, and brain. TB disease in the lungs or throat can be infectious. This means that the bacteria can spread to other people. Like we said before, TB in other parts of the body, such as the kidneys or spine, is usually not infectious. People with TB disease are most likely to spread it to people when they spend time, like the people they spend time with every day, family members, friends, co-workers, or schoolmates. I have a picture. You'll see it's basically of the tuberculosis, how it spreads from person to person on my slideshow. How does tuberculosis cause disease? The host and cells and environments for TB is transmitted from an infected to a susceptible person with the airborne particles called droplet nuclei. Transmission occurs when a person inhales the droplet nuclei containing it, and the droplet nuclei transverse in the mouth or nasal passages, upper respiratory tract, and bronchi to reach the alveoli of the lungs. The signs and the symptoms of TB, it's pretty plain and simple. It looks like it really depends on the bacteria, where it's growing. Usually grows in the lungs. They may cause symptoms such as a bad cough that lasts longer than 3 weeks, pain in the chest, coughing up blood, phlegm from deep inside the lungs. Other signs of symptoms of TB are weakness or fatigue, weight loss, no appetite, chills, fever, and sweating at night. The testing and diagnosis for this, there's 2 kinds of tests. They have a skin test and a blood test. A positive skin test or positive blood test only tells that a person has been infected with the bacteria. It does not tell whether a person has latent TB or latent TB infection or has progressed to the disease. Other tests, such as an x-ray, a sample of your phlegm, are needed to see exactly what the person has. Oops, let me go back. So the skin test is also called the tuberculin skin test. Requires 2 visits with a healthcare provider. The skin test is performed by injecting a small amount of fluid called tuberculin into the skin on the lower part of the arm. A person given the tuberculin skin test must return within 48 to 72 hours to your doctor to see if there is a reaction on the arm where they did the injection. The results depend on the size of the raise and how hard it is and the swelling. The blood test is called an interferon gamma release assays, or IGRAs. Two blood tests are approved by the U.S. Food and Drug Administration and are available to the United States. They have the names of the test as well. Quantiferon TB Gold Plus, and then they have the T-Spot TB test. The treatment for tuberculosis, if you have an active TB disease, you will probably be treated with a combination of antibacterial medications for a period of 6 to 12 months. The most common treatment for active TB is a isoniazid. It's called an INH in combination with 3 other drugs: rifampin, pyrazinamide, and ethambutol. I think it's ethambutol. And I'm not really good with saying that, but I did it. To prevent the spread of tuberculosis, take your medicine exactly how they prescribed it. Don't skip or, double up or stop. When you cough, sneeze, or laugh, cover your mouth with a tissue. Put the tissue in a closed bag and throw it away. Do not go to work, school until your healthcare provider says it's okay. Avoid close contact with anyone. Sleep in a bedroom alone. Air out your room often so the TB germs don't stay in the room and infect someone else who does enter the room if they need to. And that is my presentation. Thank you. I appreciate it.